Once the pandemic began, everything basically changed for us. There was so much uncertainty going on out there about COVID, and no solid treatment plans were yet established. It was basically a lot of experimentation going on. So we ourselves got caught up in, well, what do we do? How do we handle the care? And I think that was a time when our team really rallied, because we realized we're going to have to become self-sufficient and really focus on taking care of patients. Everyone from housekeeping, food service, nurses, respiratory therapists, pharmacists, and even our physicians, we all teamed up around what needed to be done. Healthcare delivery is a team sport. There's no question about that.
The leaders themselves wanted to make sure that we weren't just putting all these processes in place and we were just staying away from the units. So we made sure that we were up on the floors as well. Constant rounding, the DQM, the CCO, myself, going up there and just checking in with staff. We have the appropriate specialties to care for these patients. And we saw that. With the number of successes time and time again that we saw in the last 2.5 months, we were able to get patients home to lower levels of care where they probably wouldn't have without utilizing a long-term acute care facility.
We had our first COVID patient that I actually admitted. He was our first one in March. He just left last week. He went home without oxygen, without a trach, without anything, and talking and alert. Stories like that, really hit home to me. This is why I got into the health field, is to see that. Here at Kindred, we see that. We're with them every day, and we get to see that journey, and it is so satisfying to me.
Those kind of accomplishments are wonderful to see, especially with this disease, the COVID-19, with so many fatalities. And now they leave and they go back home to their loved ones, and they give us either the fist bump or the peace sign, when they leave. It is amazing. But it's also amazing because the staff, as I can't say it enough, they are so committed. I am so proud of them, how they have come through this very scary time and have arose to the occasion, which I knew they would. And I tell them every day how proud I am of them.
I mean, it's so rewarding, both, professionally and personally. I mean, you see these patients, you get to know them. You're like, a little bit of your heart is with them, and then they get to go home and see their family after so long and just actually live like they were living before. And it's so incredible to see it.
With a place like Kindred that helps you recover mentally and physically, it's rewarding. It's a story that gives you goosebumps.
It's great to be a part of a team that's able to fight this pandemic and be able to get people back to where they were before. It's a job I love, I really do.